So the today's question is, what should a patient do if a device which is a pacemaker or an implanted cardiac defibrillator gives DC shock is an old one? It was first implant was done many years ago. Now it has been changed and has been infected. I'm Dr. Vipul Roy. I'm a senior consultant cardiologist at Indraprastha Apollo Hospital. Now, should a device be infected, the first thing has to be that it has to be removed. Because if you don't remove it completely along with the wires, infection will stay. It can cause severe life-threatening problems to the patient, especially in form of endocarditis. We are lucky that we have technology and we have means to remove all these without surgery. And let me tell you one again positive thing, we are able to remove not only the device, even several years old leads without using very expensive tools which are required to extract them. So A, we are able to remove them without surgery. B, we are able to do them without very expensive tools. So we are a very good centers to come for it. And let me tell you one more thing. We are not only removing them to cut the patient's cost. Of course, the lead cannot be reused. But the old pacemaker and the device and the pacemaker which has a good battery life, we re-sterilize them and then implant it to the other side. And thus, not only we are able to save the patient from a very major surgery, we are also able to save the cost of the patient. And we are really one of the best centers in the world to come and get such patient done. In the same context, I would like to tell you one more thing as somebody had asked earlier. The discussion. We are one of the good centers in another way also. We are not leaving our patient for the complex programming or a pacemaker ICD program for industry person to do the programming. Our cardiologists themselves are involved in doing the programming and solving the problems related to the devices.